doctor is going to use this for prescription and managing patients and the treatment history, everything. So how doctor and nurse are going to operate this, how they are going to use this. So doctor has to go to OPD. They can check this notifications. This bell icon is there. So whatever the respective notifications are set for doctor, doctor is going to receive those notifications. In the same way, relevant notifications will be sent to respective departments. Only those relevant notifications will be sent to respective department. Okay. So now doctor is going to log in with his login ID and he will go to OPD patients, and he will see the list of patients and what time it's been assigned to him. So here, for example, today is 15th and today he has one appointment of Mr. Swami. So here, right hand side, you can see add prescription. Doctor can set the prescription from here. Okay. From here also, there is a shortcut for prescription. And now, if in case doctor want to do the complete treatment history, so here you can see this patient ID, patient OPD number is there. No? Here, doctor has to click here. So the moment he click here, he'll get a complete options and dashboard. So here, top you can see visits, medication, lab investigation, operation, and all the things, whatever everything is there here. So after coming to this page, here visits are there. No? Here you can click on visit, and here you can see here add prescription. From here also you can set the prescription. So now I am going to show you how he is going to set the prescription. I'll click here. So header note, you can give some notes here. This is very critical, need admission. So if you can skip this as well. So we have made it very simplified and we have made it very simple. So as per the requirement, you can set the finding category, finding list, and description. Okay, in your masters. Once it's done, immediately you'll be able to put all of this. So if in case you want to put some vitals, his BP, sugar level, or anything, whatever the check are there, he can do it. So here, for example, ortho, gynec, we have created multiple categories. Okay, so in this, I'll just take skin. If it's a derm, okay, skin, or else any finding, the patient what he is undergoing, so his signs and symptoms, everything can be set and made it very simplified. Just within click, he can able to generate the report. He can put all his findings. So general finding, I'll click on general. See your multiple list are there, which we have created. The patient is suffering from obesity and poor hygiene. So whatever he observes in his findings, whatever he come across, fever documented. So multiple findings he can select here. And now he's going to prescribe the medicine. So see here, click here, and different categories are there. If it's a medicine, if it's an injection, or if it's an IV fluid. So we'll select medicine, and whichever the medicine is there, we'll click here. You can search with the medicine name. Okay, paracetamol. So the moment he types 3-4 words, it will show him. So he will select, and it shows low stock. It will monitor the stock. It will check the stock in the pharmacy, hospital pharmacy, internal pharmacy. So now prescription dosage. He has to prescribe the dosage 100 mg and interval. So all these things you can change and modify as per your requirements. under masters, under settings. Okay, everything you can change, you can simplify much better in a shorthand, thrice daily. So dosage duration 1 week he has to take, and if you want to add multiple medicines, he can say here now injection. He need one injection, so he will suggest some injection here, and any injection, how many days, once daily. So as per the prescription, he is going to make this, prepare this. Very simple. No need to write, and within clicks, he can do that. Now again, one more tablet is going to prescribe. So, so once all this is done, once prescription is done, now here, see here, notification is done. No? Very importantly, here right hand side you can see this notification whom you want to send. So for example, this is a medicine, so you want to notify this to the pharmacist. Okay, and the same he want to notify to himself and the accountant, and if in case admin, so he can send the notification to all of these departments. Okay, and if in case you want to attach any existing report documents, you can click here and attach the reports. So now here right hand side, if in case you want to prescribe some scanning, okay, some scanning or some pathology test. So he can select here and he can say sugar, blood sugar test is required, and scanning is also required. So in a radiology, if you click here, just type it, okay, X-ray. So the moment I type X-ray, so I'll get multiple X-rays. So we need a abdomen X-ray to be done for this patient. So, and this many medicines, and these are the findings, what doctor has found after seeing his signs and symptoms. So now he also want to send this notification to all of them. Okay, so he will select all the respective department and save it. Yes. Now, if you see this notification, click on this notification, the respective team and the department would have got a notification of this prescription. So next, now prescription is given to Swami. Now we'll click here. Further, if in case there itself, you want to give him some glucose, if in case any treatment, or there itself instantly, if in case you want to give some medicine, see here you can see this medicine option. He can add some medicine dosage right away, there and then itself, on that particular day itself. So what time he is going to give? This will pick, by default it will pick the system time. So no need to change at that particular time. He is giving him some emergency medicine there itself. So here a list of medicine will appear. So how much dosage he has given, he or the nurse, it might be, he may ask nurse to give the medicine. So now there itself to Swami, this medicine has been given. And the remark, any remark, patient was very ill, any remarks, if in case you want, you can specify here. So now save it. So this medicine is been, it will be saved in his record. So what happened? Swami came, doctor took all his vitals, and or when nurse log in, nurse can take all the vitals and mention it Under vitals here, you scroll right hand side. Here you can see the last option, vitals. So she can add, nurse can add multiple vitals. I have mentioned this many. So height, weight is 110 kilos, assume vital value or date when she has checked. Okay, and sugar, if in case BP, blood pressure. So just type it, blood pressure. See your BP. BP is 110 or 130. This person is having high BP. So here we have kept this suggestions. Okay. So what time the checkup was done. So all of these vitals nurse can add, and the pulse rate. So pulse is normal 90. So when it's been taken. So like this, a complete patient record is been created. Okay. So now here you can see under vitals, what are the things been added. So after nurse has added all of this, so now doctor has asked the patient to do some pathology test and radiology test. Okay, so now we'll go to pathology department. So here I'll continue this pathology department in next video. So we'll just finish because the video will become very lengthy. So upcoming OTP. So the moment we click here, now we'll be able to see medication, what the medication was given. Now lab investigations are there. No, these are the pathology lab test which has been prescribed. So doctor feels now that Swami has to undergo some minor surgery or operation. Okay. So here you can see this top here, operations. Click on operations and add operation. Okay, if in case you feel any small operation needs, say any procedure needs to be conducted. So when he is going to do this operation date, I assume tomorrow is going to conduct this, which is 16, and what time. So here, as I said, here down you can see this clock icon. You can click here and you can change the time. So he's going to conduct the operation at 1 p.m. Okay. So now Dr. Shruti is handling this patient now, but whereas for the operation, assume Dr. Hitesh is going to do this operation. So she is going to select this and anything, any further details if you want to add, who will be the OT technician, who will be the OT assistant. So everything can be mentioned. So once whoever sees this report, it will be informed to the respective person. So now Dr. Hitesh is going to conduct this operation. We'll just save it and it will be updated in the records. Here you can see under operations. So now the complete overview of this patient, you can see it here. So whatever the vitals are there. So as per the reference range, if in case is temperature is high, it will notify here. So the complete report is ready. Lab investigation, whatever the lab investigation is updated, you can see it here. So what was the report here? Right hand side, if you take your mouse here, you can see the report. Okay. So the what is the result? Thank you for watching.